Hello and welcome to our special COVID-19 update at this hour. I am Ladi Akeredoluale. Here are the highlights. COVID-19 virus is very real, says the NCDC DG. Nigerians should take it seriously. Federal government asks for patience and understanding in the enormity of challenges associated with COVID-19, including palliatives distribution. And Spain's COVID-19 death mark passes 14,500, while the United States infection rate surpasses 400,000. All right, we'll start off straight with what the latest is, the very latest from the NCDC. That's the Niger Center for Disease Control website. If we have it right there on the screen, there you have it. As you can see from that website, at this very moment, the number of confirmed cases remains the same as it was yesterday. That's 254. It's quite possible that, of course, before the end of this program, there might be an update to those figures, which might necessarily show an increase. But there you have it. There's also information there about tips on how to self-isolate, about numbers to call, and social media handles to reach out to should you have any questions or issues to raise on this very serious pandemic. That's the NCDC website. Now, the Director General of the NCDC, Dr. Chikwe Ihekwazu, has been speaking on the reality of the coronavirus pandemic in Nigeria. He explains that the recorded number of cases and deaths in Nigeria shows that no one should be in doubt as to whether the virus exists at all. Dr. Ihekwazu added that no one should think at this time that COVID-19 is a form of deception.
The first question was whether COVID-19 is a hoax. I think anyone really asking that question at this point so many families have lost very dear ones, people very close to them. There hasn't been an outbreak in my lifetime that has played out in real time as much as this one has. We've been in touch with many of these patients, and myself, the Honorable Minister has called many of them himself. This is not a hoax. If patients want to talk about their experience, it's really up to them. It's not us as government to push any patient to speak about their experience of an illness. I noticed on social media today that one or two of those that have been discharged have been speaking about their experience. If you want to hear from them, I encourage you to reach out and let them decide whether they want to share their stories with the press.
Meanwhile, Nigerians have been asked to exercise a lot of patience at this time, as all federal government palliatives will get to as many vulnerable citizens across the country as needed. Speaking today at the Presidential Task Force briefing in Abuja, the Minister of Interior, Rauf Aregbesola, made the analysis on what each citizen would get using a state as reference.
From my own interrogation or interaction with people, I discovered that there is a gross misunderstanding. Is it misjudgment on the part of a section of the population on how far can this thing go? And I felt I should do some analysis to throw light on this area. Let's take 1 billion naira. How many Nigerians could 1 billion naira serve? Because it's important we elucidate on this to inform people about their expectations. 1 billion naira will go round the following people in this order. If we are to give 1,000 naira to deserving Nigerians, 1 billion naira will serve only 1 million naira, 1 million people. If you are to give 1,000 naira to people, 1 billion naira could only serve 1 million people. However, if you are to make it 1,500, a billionaire will serve 667,666 people. If it is 2.5, if I give him 2,500 naira, only 400,000 Nigerians will get 2,500 naira. So, if this is the case, we can only therefore approximate how many Nigerians or Lagosians can really benefit from what is going around. That does not mean effort will not be made to get to as many vulnerable, indigent people as possible.
Minister of the Interior, Rauf Aregbesola. Now, we'll go back to that website, the NCDC website, because from that site, we do see that it's been updated, and there are now a total of 276 cases confirmed in Nigeria, essentially meaning that 22, as you can see there, 22 new cases have been confirmed of COVID-19 at this hour. The breakdown shows that Lagos has 15 new cases. The Federal Capital Territory, Abuja, has 4 new cases. Bauchi has 2 new cases. And Edo has 1 new case. So a total of 22 new cases reported there, bringing the gross total now to 276 confirmed cases. The other numbers, of course, remain the same, 5 deaths and 44 discharges. And from there, let's go to the Federal Capital Territory, which is one of the states that's recorded more cases. And our correspondent, Ibrahim Adra, is in our Abuja studios, from where he joined us. Ibrahim, what can you tell us about what has come out today about the compliance levels, especially with these new cases? So let's start with the compliance level in Abuja. What's the situation there?
Oh, well, compliance, it's pretty much the same like we've seen since the beginning of the week. Massive improvement over where it was in the previous week. Security men still doing their work, and to a large extent, people complying as much as possible. I mean, it's almost inconceivable to see Abuja as empty as it is on work days. I sit back and I imagine, like, whoa, okay, so this could happen. So basically that's it. But what has come out and is of interest, and I'd like to share with you, Ladi, is the number of people who now turn out for exercises, work, if you like, families. I mean, I just got off the street a while ago while coming into the studio, and you'll just be amazed at the number of people who turned out, families, children, and all working on the streets in the evening to catch up on some form of exercise or the other. This is becoming a new normal for residents of Abuja, whether early in the mornings or late in the evening. So pretty much, as far as compliance is concerned, I guess we're still on track in the FCT, especially in the city center.
Now, again, that, of course, is something that is also happening in Lagos. Of course, you have increased numbers of people coming out for exercise. But in Lagos, quite a number of them have been arrested and have, in fact, been charged and found guilty of breaching the restriction orders. I guess that's not exactly the same situation as it is in Abuja, is it?
Oh, well, I wouldn't say so. I'm not sure anyone has been arrested on account of that. Perhaps the timing is what matters. We see it happen very early in the morning, as early as 6, between that and 7 o'clock. At that time, I'm not too sure the security men are out on the street yet. So we see that happen, and then pretty late in the evening, like 7 going on to 8, 9, and even up to 12 in the night, you see people do that. I wouldn't say it's a cluster that would in any serious way violate the social distancing order. But, I mean, the security people would know better if that constitutes what they feel is a violation of the rule. But we don't have any report of such arrest so far in the FCT.
Now, in terms of the briefing that we got today out of the Presidential Task Force on COVID-19, what further elucidation can you give us?
What maybe elucidation isn't the word, Ladi. What we need to do is just talk about some of the highlights of what came out. So the officials were speaking, and they worry particularly about what they describe as community links of these new cases that are coming up. If I understand that term very well, it means they are worried about, community transmission, if you would like, compared to those coming in. I mean, as you and I know, there hasn't been any incoming flight for some time now, so we can't really be talking about people importing COVID-19. What we have and what they worry about is what we have always feared, that there would be transmission from person to person, which of course further necessitates the lockdown that we're experiencing right now. That's a valid worry, and would love to see how they go about cutting down on that number. Another issue is the private hospitals and clinics, health facilities that were asked to come forward if they have the capacity to get licensed so they can treat and manage coronavirus cases. It's an interesting one. It's further boosting the capacity of the nation to tackle the issue. What one needs to worry about, though, is if you're bringing on private people who have private hospitals or clinics, you're asking question now, what is it going to be? Are they going to close their initial practice and focus solely on this, or they're going to be running them side by side, in which case you now have another problem you're creating. Are they going to be using the same facility for normal day-to-day clinical works plus testing and managing COVID-19 cases? So these are issues that I'm sure they would talk and trash thoroughly before licenses are issued to such private practice. They also worry about, in an answer to one of the questions, they made it clearly that it is almost impossible to do a door-to-door testing. I guess that goes without saying. But then a diaspora, it's interesting to know that there are Nigerians who are interested in coming back to their fatherland at a time like this. And Minister of Foreign Affairs is saying they are in talks with certain countries around the world to bring back those people who are actually interested in coming back. And then they also talk about accountability of the entire process, the funds that have been donated to manage COVID-19, which is interesting. It falls in line with what we saw at the National Assembly again today, leadership of the National Assembly speaking with members of the federal executive on how to judiciously use every money that comes in. This interface, everyone will agree, is very good, and I guess it will engender the kind of synergy that is required for smooth running of affairs. Ladi.
Thank you very much, Ibrahim. We'll, of course, be keeping in touch with you and expect that you give us further updates. Our correspondent, Ibrahim Adre, joining us from our studios in Abuja. Back here, a 15-man medical team from China has arrived in the country. Members of the team were received by the Minister of Health, Dr. Osagie Ehanire, after they arrived at the Nnamdi Azikiwe International Airport in Abuja. The Chinese ambassador to Nigeria, Dr. Zhu Pingjian, told journalists that the medical team will be assisting Nigeria in efforts to contain the COVID-19 pandemic. Ambassador Zhu explains that the doctors are experts in infectious diseases, respiratory illnesses, cardiology, and intensive care. According to the Minister of Health, members of the team will be quarantined for 14 days before they are allowed to bring their expertise to bear. Well, quite a lot of medical discussions, but one group that, various groups, of course, are affected by the various activities concerning COVID-19 and the efforts to contain it. And one of such groups is the Restaurants and Foods Services Association of Nigeria. With a wide membership, I'm being joined by its national president, Mrs. Kehinde Kamsin. Thank you so much for joining us. Good evening. In what ways have your members been affected by COVID-19?
Well,
I mean, as groups, as a group, actually.
Oh, yes, that has been phenomenal. That's been very devastating, not just to our sector, but everywhere. I mean, the whole thing is catastrophic, but you do know that for the food industry, people would always say, people eat. That's what people say. They say the food business is good, people eat. Indeed. But there are underlying factors, like when you present in corporate style to your customers, and it's not particularly very nice right now. And even before now, it has been strained. So it definitely has affected us. The immediate effect was the total free fall of the customer base. People who don't feel safe to be out there interacting. You can't socially distance and be interactive with your friendly food provider.
Indeed.
So that has its impacts. And of course, there are so many problems associated with the lockdown. To start with, there's restrictions for people to move. So how do they get to you? And how do your workers get to the workplace without further exposing themselves? So there are lots. Then there's supply chain issues.
Actually, that was what I was going to ask.
Yeah, there are serious supply chain issues. You remember the President Muhammadu Buhari's broadcast on, I think it was on the 29th, Sunday,
yes,
which exempted the food services and food sector from all the interferences across borders and even within the restrictions. But the truth is that that's not how our experience is playing out. The experience of members, particularly those that operate outside Lagos and who have depended over the years on a lot of raw materials coming from Lagos. So that has been really a very down low for them. And as it
What has been the specific problem? Is it that they're not being allowed to move anymore?
There is problems that emanate from different states being ruled by different directives. Okay. For example, Lagos State permits our sector to operate, but under certain circumstances, you shouldn't have more than 20. It should be mostly takeaway, apply all the, restrictions and all that. But take a place like, say, Port Harcourt. You can't move into or move out of Port Harcourt. So we do have members that move raw materials across the state borderlines, and they can't move. There's always delays. There's always sometimes overzealousness on the part of the law enforcement. Sometimes they are just not allowed to move. Sometimes the delays result in damages, spoilages, and outright, stoppages along the way. So within a short time, some operators will not be able to continue operating where they have depended on some seasonal, some convenient raw materials from Lagos. And remember that Lagos has a very active port, and so a lot of imported items that we use for garnishing are there. Some items are just particularly cheaper from this side, like our packaging. It can cost ×2 if they are sourced up north. Okay. So those are some of the challenges they're having. And of course, the challenges cut across the entire economy. It's not peculiar to us, but for us, certain things are grounding us right now.
Now, what would you want to be done? What can be done? What would you advise to be done to make this situation a bit easier on your members?
Okay, at times like this crisis period, sometimes the regulators and the government functionaries are not quick to respond. For instance, it's very simple. Let's have a tracking document for every logistic vehicle or truck or whatever that's moving across state boundaries. Let's have it properly documented. Let the law enforcement recognize that this is an association and its members are conveying nothing illegal but what Mr. President himself has endorsed. And once we're able to show something, then they should allow us easy passage. And of course, there are so many ways that government can also assist, because we can assist government. We would like to assist government as well in many ways. But, there are still so many financial controls that the government that are not necessarily linked with COVID-19 right now, but that the government can do to alleviate the problems of businesses generally.
I'm going to ask you to expatiate on that
Definitely.
a little bit, but we've got to take a break now.
Yes.
When we come back from the break, I'll ask you to expand on that. So please stay with us. Thanks for staying tuned. Welcome back. we're still with the National President of the Restaurants and Food Services Association of Nigeria, Mrs. Kenya Kamson. Thank you for coming through. Before the break, and to wrap up the discussion now, you were about to talk about what are the things that need to get done.
Yes.
And I said, okay, I would want you to expand on that. And also use the opportunity to now talk about some of the things that you have or would like to do for the government at this time.
Straight off, what we would like the government to do for us is to immediately attack that problem with logistics and supply chain disruption. Reason, this has been even before COVID-19. And whatever is done now will actually extend beyond this period. So it will help us that government actually comes to our aid in that respect. And we have gone ahead to provide a tracking document that we just want government to endorse and recognize, so that all the law enforcements along the way know that, oh, this is REFSPAN. And REFSPAN is big. REFSPAN has all the big industry movers in our sector. So, I mean, the big players are with us. All the likes of Chicken Republic, Tasty, Sweet Sensations, Tantalizers, all of them are with us, and some fine dining restaurants. And as a matter of fact, other food-related businesses like those who make equipment, manufacture equipment, and so on and so forth, and food suppliers, supply chain people. So it's about time that government gave us that air. And of course, I don't want to sound like I'm asking too much, because everybody is entitled to be treated nicely after and during this period. But government is going to have to look at certain things, because these are really terrible times. And we don't even know what's coming next, because we haven't seen Nigeria respond to this pandemic. We are still at the very initial stages. And I really pray that we get over that and we're able to track it in its buds. But my concern is that we can see very little ahead. We don't know what's going to play out. And government can actually do some tax reliefs, even if it's for 2 or 3 months, to get over the effects of this pandemic. It may become necessary. And judging by whatever happens later, government may see it compulsory to do that, because this has really brought the whole economy to a halt and has affected employers of labor. Now, we are talking as business people. How about our employees? These are people who woke up and within the space of a week, the jobs are gone. The truth is that nobody can send workers home for a month and without any business be able to pay them. So, except for maybe some reserves that may be, or some kind of insurance, our workers are expecting nothing. And that is a blow to them. So there must be, I know that the Lagos State packages and the federal packages will come a long way to alleviate, but there's nothing like losing a job for whatever time frame. And it is obvious that after this pandemic, things will never be the same. I don't see this landscape remaining the way it was before COVID-19. I am certain about that. We all pray for a better tomorrow, but we need to be realistic about changes about different types of changes that our consumers are going to exhibit. People must eat. Yes, everybody says that. But there are all sorts of cheap options, and so all practitioners are going to have to look inward, re-strategize, look at a lot of things, change the way they do things, change the way we buy, change the way we sell, change the way we communicate with customers, change the way our processes, change all that we do to mitigate the outcomes that God forbid, are worse than what we have today.
Now, in our last minute, I'd like you to use that to talk about those things that you said you in turn
Yes,
would be
want
angry to do for the government.
Yeah, say not what you want the government to do for you, say what you can do for the government. It's a vice versa thing. That is how civilized societies are run. And we think that we can lend a voice to the government in communicating about coronavirus, COVID-19 to people in general, even beyond our customers. We can lend the government our voice. We can use our facilities to serve the government. What am I saying? I mean, we're hearing of relief packages that many of the state governments are deploying to ease the period for the populace. We hear that some, the citizens did not fully appreciate these packages because maybe there has been interruptions in reaching them. But we can lend the government our facilities. They can be vehicles, they can be, channels by which government can reach the people, number one. We can use our facilities to help cook for government without any expectation of any unusual reward. Once our costs are covered, then in terms of actual costs, then we can help. We can help government cook. We can help them take to designated stations for distribution. We can help them do all sorts of things because the members of the association are respectable brands of credibility. And that is the only thing we can do right now. And of course, that one or two, several members have started, giving back. Exactly. I can tell you straight off that at least about 5 members of the association have been giving meals to the isolation centers, to the caregivers, to all the logistics people, to the research stations. It happens daily. We move food back and forth on a daily agreement. Some have donated 2,000 meals. Some have donated 1,000 meals, and they are dispensing it by the day according to the requirements of the health authorities. And, there's so much that we can do for the government right now.
Thank you very, very, very much. I've been speaking with Mrs. Kehinde Kamson, who is the National President of the Restaurants and Food Services Association of Nigeria. It's been our pleasure having you with us. Thank you so much for coming in. Now, we move on. This time we'll go to the southeast, where Tope Kutei has the update on the situation in Imo State.
Good evening. It's the second week of the lockdown of Imo State by the state government. And as Imo indigents continue to grapple with the economic hardship caused by this lockdown in order to prevent the outbreak of the coronavirus disease in Imo State, the federal government has commenced the payment of the 20,000 naira conditional cash transfer to existing beneficiaries on the National Social Register. The Minister for Humanitarian Affairs, Sadiya Umar Farouk, disclosed this in Owerri, the Imo State capital, when she visited the Imo State Governor, Opuzodima, at the Government House here in Owerri. She said the payment will be from January through to April 2020, and all existing beneficiaries on the National Social Register list should visit the designated areas for their payment. The minister also disclosed that the trader money loan has been disbursed to traders who earn a day-to-day living from their trading. The minister also disclosed that relief materials from the federal government has arrived in Imo State to cushion the effect of the COVID-19 pandemic in Imo State.
And this money, we have also flagged off the disbursement in the FCT and other states of the Federation by disbursing 20,000 naira to the poor and vulnerable households. And this amount covers the period of January to April 2020. As of 3rd April, Your Excellency, 110,202 household beneficiaries have been paid in 7 states across the nation, and payments to beneficiaries in Imo State also commenced yesterday. It was supposed to have commenced yesterday, but I am meant to understand that we are starting the payments today.
All right. Our correspondent, Itokwe Kute, reporting there from Owerri in Imo State. Now, 26 persons are presently in 14 days isolation in one of the centers in Niger State. They were intercepted after an alert from members of the community that a member suspected to be positive to COVID-19 was heading into the state. Our correspondent there, Emperor Simon, has more.
Authorities here say they got alerted about the arrival of the 49-year-old man from Lagos State, and since his arrival, they've been on his trail. But like Jonah in the Bible, the man has been trying to escape from the face of authorities. The last time he tried to use this truck behind me, which was carrying about 26 other passengers, at a market in Makira in Mashegu local government area. But the authorities were able to trail him, and they got him. He didn't end in the belly of the fish like Jonah, but he ended here in a quarantine.
His community members who said, look, we had this person from this community. We were told that he was infected in Lagos. It could be true, or it could be true or not, depending on the kind of sickness he has exhibited. So we should not allow him to come into our village. So right from Lagos, he was tracked down to Makera. He came in as an individual, not because he has came into a bus or no. He came to Makera Market. Makera Market was yesterday, day before yesterday, and then of course from the market he was traced, and then he followed this vehicle that you're seeing out there, with other innocent marketers who join this counter, going to their various villages. But unfortunately for them, because of the surveillance, we had to get the man together with everybody that was on the vehicle to ensure that they do not interact with other people.
Since the arrival, first and foremost, because this issue of stigmatization, mental effect, they were properly addressed. They are not here as arrested. They are not here under confinement, but for the benefit of the public and the world in entirety. So they understood the situation, and they were being properly taken care of in terms of meals. In fact, if to say you have their voices, they will have told you that they even have what they are not taking in their houses, that is what they are taking here, and including the environment. There is lights, they have fun in the place they are coming, there was no even light there.
For now, we await what the results of the samples taken from the persons in quarantine will be. From Mina, Emperor Simon.
Thank you very much, Emperor Simon, for that report sent, of course, earlier in the day. Now, I'm being joined in the studios here by the President of the Pharmaceutical Society of Nigeria, Mazi Sam Oabora. Thank you so much for being with us.
Thank you so much.
It's a grim period, but I want to start off with the issue of chloroquine. It started off as a preliminary discussion, but then Nigerians took to it. There are controversies even over the clinical trials associated with chloroquine. What can you tell us about that?
Well, I think that the truth of the matter is that since COVID-19 is a new disease, and given its nature, people are looking for a cure. And anything that gives hope, they will take. That is why chloroquine and hydroxychloroquine have become major issues. Of course, that's not the first time medications that have been useful in other indications have been found to be helpful in other areas. And so it will not be out of place. But I think it is the method of communication that is the issue right now. If the standard method is that a product goes through a clinical trial and acceptable for particular indication, and then it's recommended. Of course, in times of emergency, some of these things are breached, and something that hasn't gone through all the trials, but you have established its safety in the general population, and there is some report that it is useful, the government can decide to use it. That's what's happening in the United States. The United States government has gotten the FDA to give an emergency use authorization so that chloroquine and hydroxychloroquine can be used. Now, I think through a normal process of communication, Nigeria can determine to adopt each protocol. I understand some clinical trials are going on right now, which will establish that this product that is approved is now useful in another indication. It is not useful, it's not yet approved for use in COVID, but it was used very well in malaria.
That's right.
And today it's also being used in rheumatoid arthritis and autoimmune diseases. So I think that we should control communication and advise every patient who has a clinical manifestation to see his doctor for a proper advice, or to see his pharmacist if he is in a position to take medications.
Right.
Our position is that for this problem, you should not self-medicate. You must first identify and be sure that you are treating the right disease. Otherwise, you may
be making the problem worse.
Exactly, because chloroquine, as safe as it can be, but it is when it's taken the right dose and in the right conditions, it can worsen existing situations. It has some side effects, which only a proper evaluation by a clinician or in a clinical setting, or proper advice by a pharmacist who knows your renal history or your liver history, and such areas can advise you to take a particular dose. But the truth of the matter is, when a drug is not taken as prescribed or recommended, there is some danger in it.
Now, of course, you have you are a major stakeholder in this process, the pharmacists as well. What have you made of the general response, the way Nigeria has attempted to contain this? Those who have sat in the chair you are sitting in now before you have indicated that we are still at the preliminary stages, considering what other countries are doing.
Yeah.
But on a general note, how do you think we have done so far in trying to contain this?
Well, I think first that we started slightly with a sure foot, where we didn't start as seriously as we ought to. Because if you recollect, I think it was Channels who reported about a senator who was complaining that he arrived at Abuja and there was no proper screening. And 2 days after that, the first case broke. So that was a clear indication that we were a little bit flat-footed at the beginning. But I think that since this broke, we have seen some very heroic efforts, especially in places like Lagos, and the consistency of the federal government in trying to give information. But I think we need to do more than what we're doing. We need
what areas?
We need to mobilize the professional groups. As of today, the pharmacists who are the front line, the community pharmacists, the hospital pharmacists, you hardly hear about them as being people who are involved in this. As PSM president, I've never been called by any body in government to say, what way will your professional group contribute? So also other professional groups are feeling that they are being alienated. That was why there was this uproar against the possibility of Chinese. It's because, like saying, you've not utilized your local resource. You know, why do you want other people to come? I mean, even though in principle, if China or a company decided to invite people in advisory capacity, that would be no issue. But the trouble is that Nigerian professionals in the health team, pharmacists being on the front line, they're there with their retail in their community. And you know, that's where patients go first. They go to their community pharmacies.
And they're open during this period.
They're open. So I haven't seen any discussion as how to provide personal protective equipment to pharmacists. How do we ensure that pharmacists in the community, in the hospital, in everywhere also protected? So there is some bit of lacuna in that area in ensuring that we mobilize our professionals, whether they are medical lab technicians, whether they are medical doctors, whether they are nurses, and other healthcare professionals. We need to involve them much more. I saw at the briefing today some attempt was being made to speak about that. I think we need to do so, because if you have the professionals feel alienated or not protected, and then you're talking about foreign experts, they will just turn their back. And if they turn their back, this problem cannot be sorted out by what we're doing at the presidential task force or at the media levels. The work is ongoing as I'm speaking to you. People are going into pharmacies, they are going into hospitals, they are going into clinics beyond the identified quarantine center. Yeah, so what we need to do is to upgrade, to mobilize every resource so that anywhere the patient comes in, if he comes to a pharmacy, we've told our pharmacists the first thing is any patient that comes is tested. You look at his temperature, and if he has any of the indications, if he's coughing or he's sneezing or he's having health, you interview him and you immediately refer him. Now, if somebody comes with ordinary flu, ordinary cold, I mean, you still have ordinary cold symptoms that does not respond to all those things, then you can make some recommendations. I think, but in the interim, if the person that visited you has the infection and you're at the pharmacy, in the hospital, or in the community, you have become exposed. So I think there must be a general mobilization of all the facilities that we have, of all the resources we have, so that we can be seen to be confronting this together. Secondly, sir, if you don't mind, I also...
No, we've completed... I'm sorry,
okay.
but we're going to have to end in here. We've run out of time.
Okay.
I'll be speaking to the president of the Pharmaceutical Society of Nigeria, Mazi Sam Ohabua.
Yeah.
I wish we had more time, and I'm sure we will. This is not going anywhere very in a hurry, so we will be back to talk a bit more about this. But we'll take a break. Thank you so much for being with us. We'll take a break, and when we come back, we'll be taking our global update. So please stay with us. All right, thanks for staying tuned, and time for our global update. The number of COVID-19 infections in the United States is now said to be about 400,000, according to a tally by Johns Hopkins University. It also shows that more than 12,900 people have died after catching the virus. Meanwhile, the UK Prime Minister Boris Johnson, who is still in intensive care, is said to be improving and can sit up in bed. So says the Finance Minister, Rishi Sunak, as hospital death toll from COVID-19 nears over 7,000 in the UK. The numbers in Spain, however, continue to show worry as the death toll rises past 14,000, with a single-day death toll up by 757 compared with 743 on Tuesday. Now, we're being joined by the NHS GP Registrar at the Queen Elizabeth Hospital in Kings Lynn, Norfolk in England, Dr. Iyala Douglas-Pepple. Dr. Douglas-Pepple, thank you so much for joining us at this time. It's nice to have you with us.
Hello, good evening. Thank you for having me.
Now, we keep hearing about the situation in the UK, death toll rising and all the other issues. Could you update us on what the situation is over there at this time, quite briefly?
Oh, thank you for that question. So basically, I mean, we know how this pandemic is spreading very quickly, and all efforts by government and health officials are trying to see how we can flatten the curve and contain the virus. The lockdown measures, which have been instituted by the Prime Minister for about 2 weeks now, seem to be yielding some positive effect, because even though the death rate seems to be climbing as well, it's not climbing at such a very dramatic number. So I think so far we're doing everything possible, especially by the NHS and all the healthcare professionals involved, to see how we can try as much as possible to limit the spread of the virus.
Now, in Nigeria here, of course, we have conversations about the healthcare professionals themselves who are in the front line of the fight against this. In the UK, where you are a prominent member of the Medical Association of Nigerians across Great Britain, died after contracting the coronavirus. I'm talking about Dr. Alpha Saadu, and we have since heard after that that a couple of Nigerians are said to have died from COVID-19 in the UK. What can you tell us about that, especially in the broader context of how this pandemic is being contained within the United Kingdom?
Yeah, it's quite unfortunate concerning the death of the medical personnel in the fight against COVID-19. The thing is, as medical practitioners, we're trying as much as possible to see how we can also reduce our exposure and our risk to people who are positive and the cases that we treat. The government here is doing everything they can to see how they can provide adequate protection in terms of personal protective equipment, which, I mean, we have different types, the standard one and the enhanced one, and they are worn at different scenarios as well. So everyone is encouraged to be adequately protected. Testing also, especially for healthcare practitioners, is ongoing now. So we're doing everything to see how we can help the public, but at the same time, trying to protect ourselves as much as possible, because it doesn't really make sense to become a victim of what you're trying to treat.
Now, finally, of course, I'm sure you have heard about what is going on in Nigeria. Is there anything, very briefly, that you can tell us about what you think should be done at this end to better contain the spread in Nigeria?
Yeah, so borrowing from what's happening here, I think, first of all, the NHS, in response to containing COVID-19, has been well organized. For instance, in the hospital where I work, we have demarcated areas for patients who are suspected or even those who are confirmed to have COVID-19. So we have the green and the yellow zone. So that there is a clear demarcation of patients who are positive and those who are not, just to protect people, and as well as adequate protection of adequate supply of PPE, especially because I think that is what will protect people. Then the major thing that will help to limit the spread of this is a complete change in behavior. So if you apply behavioral change, abide by all the guidelines that have been given by the CDC, by all the health officials, do as much as we can on our part, social distancing, trying to stay in, obey the laws that have been given out, and we'll see that things will be going in the right direction. The thing is, it's quite a tricky and a scary time that we live in, and it's very, very important for people to prioritize faith over fear, because if you start allowing fear to become predominant, then we're going to be in a very...
Dr. Yala Douglas Pepple, thank you so much for being with us. Dr. Pepple joins us via Skype from Norfolk in England. Thank you so much for your time this evening. And that's our package on this segment of our COVID-19 special program. But before we go, let's just take you through what the very latest is on the confirmed cases profile for Nigeria. We did tell you during the course of the program that 22 new confirmed cases of COVID-19 were announced in the course of this evening, in fact, in the course of this program. There you have it. It's still as at now that we're wrapping up, 276 in total, 15 in Lagos, 4 in the FCT, Bauchi 2, and Edo 1. Thank you so much for being with us. My name is Ladi Akiri-Duluade. Do join us tomorrow at 12, 6, and 9 for updates. And, of course, keep the messages coming on our various social media handles. What are you doing during this time? Good night.